This is the 8-way reach balance routine. So this is an amazing routine, not only to improve your balance, but also to improve your strength. Really, it's a total body workout. And this series is really important, I'd say, for athletes in particular, because when you're running, you're never on two legs. The difference between running and walking is that when you're running, you're always on one leg. So it's essential that you have real good control while on one leg so that you don't get injured. So if you're running and you twist the wrong way, you have the balance, control, and strength to prevent yourself from getting injured. So an amazing routine. So the goal with these exercises, all right, in whichever direction you're reaching, is to go as far as possible with your foot close to the ground, but not touching. So this is different than, say, the swing exercise. You see here, I'm not bending the stance leg, okay, and I'm not close to the ground with this leg. It's different than, say, the bird dip exercise, all right? As I reach back with this exercise, you can see this knee is forced to bend because this foot is close to the ground. So I can't stress that enough. With whatever direction you're reaching in, always try to reach as far as possible in that direction, close to the ground, but not touching. So first things first, we want to establish a 12 o'clock position. All right, so the 12 o'clock position is basically just pointed forward. I never want to have my foot out to the side like this, all right? Always foot pointed forward. As I reach forward, it's important that my knee always tracks in line with my toes. If it doesn't, that puts me at risk for a knee injury. So if I were to say reach forward and allow this knee to collapse inward, you can see this knee is now coming inwards of the foot. That puts me at risk of a knee injury. Just the same as if my foot were pointed out to the side and my knee tracked forward like this, it's really the same thing. Again, it puts me at risk for a knee injury. So very important that we keep the knee and the foot pointed in the same direction, regardless of the direction we're reaching. All right, you can see here, my knee and my foot are in correct alignment. So that's number one. Number two is we always want to maintain correct spinal alignment. So it's common when people do these exercises, we'll see that they'll collapse their spine, all right, like so, all right? You don't want to do that. The goal of this exercise is to promote hip strength, knee strength, and ankle strength, or really in the muscles that control those joints. We don't want to have this floppy spine. So a way to help maintain that elongated, correct positioning of the spine is to think about driving the head away from the tailbone. So if my spine is always nice and long, being stretched out, it will never collapse. So as I'm reaching backwards here, you can see how I'm keeping that nice long spine. And again, that's very different than if I were to do this, all right? So we want to keep that nice long spine. If you feel like you're struggling with this, you can grab something like a shower rod, a broomstick, perhaps a PVC pipe, what have you. And you can place this on your back, all right? So if you notice, I have two contact points here. I have my upper middle back and about where my sacrum is right here. Now, if you have the flexibility, you can also take your head back, but some people don't have the flexibility for that, and that's okay. All right, so if I do this exercise and I were to go like this, I failed. You can see how the rod came off my back, so therefore I must have moved my back. Whereas if I were to do the exercise like so, you can see that the rod didn't come off my back. So it's a little bit harder to maintain your balance because you can't use your arms out like this, but it's a nice way to do the exercise because, again, it forces good spinal stability, spinal alignment, and great hip, knee, and ankle strength. I'll now go through the 8 different directions. So typically what I'll do is about 10 to 15 repetitions on one leg, and then I'll alternate to the other. So I'll just demonstrate all the directions on my right leg right now. So I'll reach directly forward. Again, keeping that nice long spine. My heel is staying on the ground. The next direction will be front and to the left, like so. Again, notice how I'm keeping that good knee alignment. Next, I'll reach directly to the side. As I reach to the side, I really drive the buttock backwards. Notice how I'm bending forward, but again, notice how I'm keeping that nice straight knee. Then I'll reach back and to the left. As I reach back and to the left, as my leg goes back and to the left, my torso goes slightly to the right. Again, always maintaining that correct knee alignment. I'll reach straight backwards. Again, driving the buttock way backwards. Between each position, I'll get to this tall figure 4 position. We'll talk about that in a little bit. Then I reach back and across. As I reach back and across, my torso goes this way as the leg goes that way, always keeping that nice straight spine, and of course, always keeping that correct knee alignment. I'll reach straight to across this time. As I reach across, it's a small movement. Really, I'm trying to get most of this movement through this hip joint right here. So I'm just coming across, trying to avoid any excessive trunk lean, but it's a small movement. And then lastly, I'll reach front and across, like so. Again, between each rep, you'll notice I'll return right back to the start position, what I call the figure 4 position. And again, we'll go over that in a few minutes. When doing this exercise, it can be a little bit confusing, all right, as to which directions you've already reached in. For example, if I were standing on the right leg and I reach and front to the left right now, well then when I'm on my left leg, I might neglect reaching in that direction. All right, so after you've done your designated number of repetitions, it helps to mark it off on like some pre-drawn out diagrams. You can see here I've drawn each of the 8 directions, okay? So after you stood on one leg, so this is the left leg here, and I've reached in a particular direction, I mark it off, all right? And I typically do about 10 to 15 repetitions in each direction. With these exercises, I've noticed with my patients and clients that it's particularly difficult to do the back 3 directions correctly. So I'm going to go over those right now. So the common error that I see is that people will often shoot the knee forward and extend the lower back like this. That's jamming up their lower back, their hip, and their knee. So that's incorrect. And you can see I can't reach back very far as I'm doing this. The correct method is really good form bending, or like a deadlift in weightlifting. So a good form bend looks like this. You can see the knees are bent. My butt is way back and my spine is nice and straight. So as I reach back on one leg, I'm going to go through that exact same motion, but of course on one leg. So it looks like this, reaching way back. And again, that's very different than doing this. So the cues, again, that will help with that is think about driving the buttocks backwards, and again, reach as far back as possible with this non-stance leg close to the ground, but not touching. Between each repetition, I like to get into what I call the figure 4 position, and that ensures that I can complete the repetition correctly. I go through the full range of motion. So if I reach forward here, then when I come back up, I'm going to hit what I call the figure 4 position. So that's me taking this ankle, the non-stance ankle, and putting it alongside my knee or my calf here. As I'm in this position, I want to be in a nice, tall position, driving the crown of my head up towards the ceiling. All right? I don't want to sway back, and I don't want to have a flexed knee. In fact, you can even be in this position and clinch the buttock of the side you're standing on. So here's a few repetitions. If I were reaching backwards, hit my figure 4. Hit my figure 4. To make this exercise more challenging, you can try it with your eyes closed, and that's very challenging. So you'll see here as I close my eyes, I'm immediately wobbling more, relying more on the use of my hands for support. Ooh, lost it. Of course, if you lose your balance, open it up so you can correct. Then try and close them back up again. And this can be quite the challenge. The other option would be to stand on some type of unstable surface, like this blue foam Air-X pad, or perhaps a Bosu. When you're on this, that'll immediately get you to wobble. So when you go through the directions, it can be a little bit harder. To turn the exercise into more of a strengthening routine, you can place some dumbbells in your hands. Again, doing about 10 to 15 repetitions in each direction. When you use the dumbbells, always remember, keep that nice long spine. Don't lose that spinal alignment like I just did. Keep that good spinal alignment. People often ask, where should you have the weight bearing with this exercise? And really you want to have the weight bearing right through the apex of your arch, which is directly in front of the ankle, all right? So if I'm reaching forward, I should never have to lift up my heel, all right? Then I'm not really correctly utilizing that arch. If you can, when doing the exercise, it helps to actively think about raising the arch of the foot, and that'll help make a stronger foot as well. If this exercise happens to generate a little bit of pain in the area of your kneecap, consider just not doing the exercise. Or, to set yourself up for success, you could do a little bit of foam rolling to the front of your thigh, the middle of your thigh, and the outside of your thigh, like so. I'll demonstrate quickly here. So lying on the foam roller, doing some rolling like so can set you up for success. And what that will do is that will loosen up all the structures in your thigh here so that your kneecap isn't being pulled out of whack. So if you feel a little bit of pain in your kneecap, try doing some foam rolling to your thigh for about 2 to 3 minutes, and that might set you up for success. If you're still getting knee pain, don't do the exercise. And that is the 8-way reach balance routine.